Yeah, yeah. So let's shift gears a little bit, and I really, really want to talk to you about the genetic expression profiling. I think this is kind of one of the future technology that really can impact the way we practice, right? For those of us for those patients out there who's looking at this video, they don't really know genetic expression profiling. Well, and can you just give us some background?
Sure. So genetic expression profiling it's different than looking. So sometimes people say, this is going to tell me, do I carry a gene that puts me at risk of melanoma? And the answer is no. What it does is it gives us information about what's going on inside of a cell, basically. So, what genes are activated and what genes are being expressed at high levels and what genes are inactive or being expressed at lower levels. So right now, gene expression profiling gives us information about one lesion. It doesn't give us information about the patient as a whole. So I think that's an important thing. In general, gene expression profiling is looking at RNA. So it's what is made from the DNA. It's not looking at the DNA that makes up the person. And there's a few different ways that we can, look at that. So there are a few different scenarios in which that can be useful. So there is I have this spot on my skin. I'm not sure if we're not sure if is that melanoma or is it benign. We can take it off and then look at it under the microscope. Or we can we can get genetic material from that and then look at that and say, the genes that are being, look for genes that we know are expressed more highly in melanoma and say, if we see higher numbers of that gene, then we would say that's more concerning for melanoma. If we don't see higher expression of those genes, we're less concerned about it. We can also do this when we have a lesion that is melanoma. So we know we were concerned enough, we did a biopsy, we took it off. Our pathologist said, yes, that's a melanoma. The journey's not over yet. You've got a lot of decisions to make next. The decisions are, can this just be excised in the office? Do we need to look at things like sentinel lymph node biopsy? Patients will always say, okay, well, what's my prognosis? What's going to happen next? How much do I need to worry about this spreading? And so we can get some of that information from gene expression profiling also. And then our colleagues in pathology, sometimes, we have to make the decision, biopsy, yes or no. They have to then say, is that a melanoma or is it not? That's not as straightforward as it might seem. So some lesions are clearly benign, some are clearly melanoma, but there's some in that middle ground. And so having more information, like what genes are turned on or off in that lesion, can give them more information. So there's scenarios in which gene expression profiling would be used by dermatopathologists as well.
Yeah, I'm so glad you just touched upon the last point about dermatopathologists, the need for leveraging genetic profiling and to make the diagnosis. A lot of times you see patient come in, they just thought that it's a black and white diagnosis, right? But we know there's so much gray area, and there's sometimes it's just very difficult. And I'm sure, like in your institution, we sometimes huddle together a group of dermatologists, group of dermatopathologists. We're looking at the photo, we're looking at the pathology, and try to piece all that stuff together. So,
Absolutely. No, we do
yeah.
the same thing. I always say I don't envy their job. I think it's really hard to have that call.
Well, they got some help now.